What a great day to talk about pharma!
This is Clyde
I'm Jaira,
and we will be discussing the topic about
the nomenclature of drugs.
only here in Vet Pharma 311. Let's go!
Nomenclature implies assigning proper name or names to a particular compound so that its study, marketing, or use may become systematic. Nomenclature of drugs is simply known as a system of naming drugs based on its chemical component and molecular entities by the official governing bodies. Most drugs available in the market have at least 3 different names. These are the chemical name, non-proprietary name, and proprietary name.
The chemical name is useful to the chemists, scientists, and technical personnel as it provides the precise arrangement of atoms and atomic groups in a molecule, or the chemical constitution of the drug. However, the chemical name of a drug is too complex to be widely used or remembered for prescribing or marketing the drugs. Moreover, there are several naming conventions or systems used by chemists so that one drug may have several widely differing but correct chemical names.
Chemical name is
Is easy to speak and spell and is often designated to identify a particular drug entity. Non-proprietary name replaces the long, unwieldy chemical name for a pharmaceutical substance and is frequently used in textbooks and other discussions in pharmacology. Non-proprietary name is also referred to as the generic name. Non-proprietary name is a short name given to a drug that is not subject to proprietary or trademark rights. It describes the common name of the drug. There are 2 classes of non-proprietary names. These are the approved name and the official name.
The approved names are given by nomenclature bodies including the United States adopted names and the British approved name. The official name, on the other hand, may be identical with the approved name. However, it is officially listed in the Pharmacopoeia.
approved name is a name given to a drug by drug nomenclature bodies as recommended by the World Health Organization, also known as the WHO. The approved name of the drug may or may not be included in the Pharmacopoeia. The official name is the name approved by the National Pharmacopoeia Commission and is included in the official book Pharmacopoeia. All member countries of WHO have decided to use the Uniform Recommended International Non-Proprietary Name, also known as the RINN or the INN, for drugs used in their countries.
Here are the list of some of the non-proprietary names, or also known as the generic name: aspirin, atorvastatin, captopril, diazepam, and paracetamol.
Proprietary name. Proprietary, brand, trade, or registered name is a name given to a drug by the pharmaceutical firm which sells the drug, although it may not have manufactured the drug itself. Proprietary names are written with a capital initial letter and are often further distinguished by a superscript R in a circle. The proprietary names are not suitable for scientific studies and are not included in textbooks. The clinicians usually prescribe drugs by their proprietary names. The following are the common brand names for the aspirin, diazepam, and paracetamol. So this is an example of a nomenclature of manufactured drug boxes. For the generic name of the drug, it is called the metformin hydrochloride, and the brand name is the glucophage. For this one, the brand name is the biogesic and the generic name is the paracetamol. For our last example, we have planoxine as the brand name and digoxin as the generic name.
In addition to the formal chemical and non-proprietary names, a drug may have a code-designated name. The Chemical Abstract Service Registry provides a unique reference number to all chemical moieties, including each salt, hydrate, isomer, and racemic form of the drug.
Other name or the code name is provided by the pharmaceutical manufacturer before the drug is placed on the market. Code-designated name helps the manufacturer to maintain secrecy during drug development and pre-marketing investigational stages.
That's all for now. I hope you learned something in this video. This is again Jaira.
And this is Clyde.
Pharma, see ya!